This will be on, okay, on the stage, please.
Good morning, everyone. So, I'm Dr. Swathi Ramamurthy. I'm representing our company, Herbal Chakra. So, before we begin with the presentation, I'd like to introduce ourselves. So, we are a herbal startup looking, registered recently, finding our ways to, establish ourselves in the world of cannabis. So, and being from India, land of cannabis, I can say we definitely have a potential here. So primarily, okay, let's begin with the presentation then. Yeah. Today, I'll be speaking on the relevance of cannabis in today's era. Like, why is the world looking at it? And what we want to do from it, where do we want to take it from here? First, let's see a brief description about what Ayurveda says about cannabis. Many of us here might have heard Ayurveda is a medicinal science. It has been practiced for ages, etc., etc. But what exactly Ayurveda says about cannabis? Do we have references? Does it speak of disease conditions, or it just mentions cannabis as a plant? That's it. What does Ayurveda say about it? Yeah. So whenever we see a description for a herbal medicine or any drug as such in Ayurveda, it's described under these, subheadings. Like its taste is described as to when we consume it, how do we taste it? What does it taste like? Does it taste bitter? Does it taste pungent? Does it taste astringent? Because the action of the drug starts from the taste itself. Right from the mouth, the action of the drug starts, is what Ayurveda believes in. So, some of the basic descriptions. But the important point to note here is that even 5,000 years ago, the importance of cannabis, if we see the indications, these are just a few. Totally, there are 23 conditions that have been, indicated for use of cannabis in Ayurveda. 23. And when we speak of the treatments there, for example, when we speak of urinary disorders, under that we can find around 12 to 13 sub-conditions where we can actually use cannabis as a medicine. In the same way, once we go down this list, like when we speak about nervine disability, it includes a lot of things, right from Parkinson's to paralytic disabilities also. So that is the most important thing here. And one more is Vyavayi Guna. It's the property of the drug, how it acts, the pharmacokinetics and the pharmacodynamics included. I'll come to that later. So these are some of the descriptions we find about this drug. Okay. So to sum up what Ayurveda says about cannabis, it's here. 29 pharmacological properties, more than 280 classical formulations, 13 dosage forms. So when we speak of dosage forms, right from yesterday during the seminar conference and all that I have been hearing, we find that it's CBD oil, CBD extract, drops, that's it. But when we speak of 13 dosage forms here, we have everything ranging from tablets, pills, linctus, syrups, powders, you name it, you have it in Ayurveda. So, and then it's indicated in 29 disease conditions, as I mentioned before. So this is the vast coverage that cannabis has in Ayurveda. So how do we use cannabis in Ayurveda? Does Ayurveda say, okay, you just add it into a preparation and make it into a formulation? No, there's a very, very, very unique way to use cannabis into medicines. So right now, what the procedures we are using to extract just the CBD or full spectrum extracts over there, we had our own techniques right from the, right from 5,000 years back. It's a very simple technique of washing the leaves of cannabis or soaking them 24 hours in water, or else just, washing them under running water, and then it's suspended into milk and boiled for 3 hours till the, majority of the narcotic toxic principles seep down to milk, and then it's taken out, the milk is discarded, the leaves are washed, dried, and then they are used into medicines. So there we reduce the narcotic principles by almost 50%. We have the research, relevant research work to prove that also. Okay, so this was what was stated 5,000 years back. Ayurveda has stated this, that. Why is it relevant today? I mean, has Ayurveda mentioned it as to be a super potent drug? Or, we have around 2,000 drugs mentioned in Ayurveda. So why is this important? Where does this stand today? Why do we have to focus so much on cannabis currently? Okay. Most of us, I assume, are familiar with the IUCN red-listed herbs and red-listed plants, the biodiversity concerns we have right now, considering the climatic changes and all that. So yeah, these are a few clippings from the published articles and all that, which states that India's wild medicinal plants threatened by overexploitation. We have a huge herbal pharmaceutical industry. So naturally, there is a lot of overexploitation of these herbs. Again, the same thing. 112 medicinal plants in Himalayas threatened, but conservation is just being implemented for 5 out of 112. And then one of the most commonly used medicinal drug in Ayurveda called Safed Musli. It's used for libido purposes and male sexual incompetence and such problems. So that is almost extinct, near threatened. That's the status of the drug. This is from 2020, the most recent list. So just to put a perspective to all of this, what is happening? 2,143 plant species are red-listed by IUCN. And I'm speaking about India. This is not a global scenario. This is just for India. So where cannabis comes over here? Most of us here, we are aware how cannabis grows. It's called weed for a reason. Doesn't need much of nurturing, but it grows and it provides so much. So where all can we replace this cannabis in Ayurveda, as well as using it in the pharmaceutical industry as such? I have mentioned a few examples. The psychological basis, very technical. Let's keep that aside for a minute. Let's see. So we can see that cannabis is indicated in anxiety, extinction of aversive memories, something in relation to PTSD, insomnia, addiction treatment, some of the psychiatric conditions where cannabis is indicated, and then the red-listed Ayurveda drugs, which are commonly used in these conditions. Nodostichus jatamansi, Valeriana welchi, Lilium polyphyllum. So Lilium polyphyllum is near threatened. We cannot even harvest it from the wild. So when we find the mention of that drug in an ingredient list, is it actually there, is the question. Rather than excluding it, what can we do? Use cannabis as a substitute there. The same thing, there are multitude of neurological conditions where a lot of Ayurveda herbs are used. One of the most commonly used group of drugs is called Dashmula. There are 10 herbs included in that, which is very potent anti-inflammatory, analgesic drug. So what happens here is 2 or 3 of the herbs in that group of 10 cannot be harvested. They're red-listed. So what can we do there? We can substitute cannabis over there. In the same way, some of the Commiphora wrightii, many people might have heard of it, gugulosterone, technical term. So one of the very potent anti-inflammatory analgesic agent used in Ayurveda for joint pains, multitude of conditions. So that is almost extinct, that's red-listed. Can we substitute cannabis with all of this? So same thing again. There are a lot of dermatological conditions, a lot of rheumatic conditions, endocrinal conditions, oncological conditions where cannabis can be substituted instead of the red-listed herbs. Same thing again with the pulmonary, gastrointestinal system. Pulmonary is concerned to lungs, gastrointestinal system. Yeah. So all of this, why did I state it now? Because that is the way we want to head forward. Wherever we are not able to include the herbs which have been red-listed, we want to try substituting it with cannabis, study the action of those, and if they have equal potency, why not? Why not use it? Rather than, over-exploiting the environment, causing harm to nature. Let's rebuild, heal the planet. So how do we use cannabis? We have been, hearing about usage of CBD as a single component, excluding the THC and all that. But when I'm speaking here, I'm speaking about cannabis as a whole herb. The full spectrum extract of cannabis is what I'm speaking here. So why is it important? Does that actually make sense? For that, I'd like to give an example. Why we use, we preferably use a whole plant rather than extracting a single active component from that. Ravolfia serpentina, reserpine, is a, medicine that is generally written to reduce the blood pressure. It's prescribed in cases of hypertension. Few years back, there was a company which brought out pure reserpine, Ayurveda company I'm speaking about. It brought out extract of Ravolfia serpentina in the form of just reserpine and pushed it into market as tablets, magic remedy for hypertension, and also that it aids in sleep. But what ended up happening was people started reporting of vertigo and then hypovolemia because of that, and they had giddiness and such issues. So where did we go wrong? Does Ayurveda state wrong about it? Or where did we go wrong? Then a research was conducted to analyze why that happened. Why was reserpine acting that way? And then when the entire plant extract was used rather than just taking out the reserpine, it was found that that was more effective because there are components in that plant extract which actually helped counter the side effects of reserpine there. So a plant, when we take it as a whole, it actually acts synergistically. So here I'm speaking about exploring that relationship. Synergistic action due to combination, counteracting the negative effects, lesser dosage, greater action. So synergistic action due to combination. What do we see here? What do we understand by this? In reference to cannabis, I'll give an example. A few months back, we did a clinical trial, a minor pilot study, on oil processed with cannabis leaves for local application on the soles of your feet for migraine headaches. The oil proved to be efficacious, of course, so there was a reduction in the episodes of migraine attacks. So if the patient was getting it on an average once every week, it reduced to once every fortnight. So there was that, but the intensity of pain was not that greatly reduced after use of cannabis. Then what we did was, in another set of patients, we combined it with a few other herbs and processed the oil out of it and then used it. That proved to be more efficacious than just a single herb. We can see this in a lot of ways as examples in Ayurveda. Like most of us here are very familiar with curcuminoids, right? Curcumin we are very familiar with. So, and many of us might know that curcumin, the active component of turmeric, doesn't get absorbed in body. It's not greatly bioavailable. So what they do is we can add black pepper powder to it, piperine, to make it more bioavailable. So this has been practiced for a very long time. Like from 5,000 years back, we have reference of using turmeric with black pepper, not just as turmeric. So that's the advantage of combining herbs. That's the advantage of combining two things together to give a better effect, better impact. So counteracting negative effects, I already spoke about how a plant works towards counteracting negative effects when we add it with few things or when we add it as a whole plant. The last one, lesser dosage, greater action. I would like to take you back to when we were discussing about the properties of cannabis, where I said there is a particular property called Vyavayi Guna that has been mentioned. So what does that mean? What does that mean? How do you understand it in the current context? What it says is, that's a property where the cannabis has the capability to get around and move into the system faster. It gets absorbed faster and it moves into the circulation in a faster way as compared to other herbs mentioned in Ayurveda. So how do we use it? How do we use it to potentiate our drugs? One of the primary concerns that people say when it comes to Ayurveda medicine or traditional medicines is that they're slow to act. They're not as fast as the modern pharmaceutical agents to act. So when we have to hasten the process of absorption and action, what can we do? Adding smaller doses of cannabis into the drug will help in better absorption and thus better bioavailability of the medicine. The same has been studied on curcumin. There are a lot of other options to discover. Cannabis improves the bioavailability of curcumin. So in the same way, there are a lot of research scope here. Now, as I was speaking about the Vyavayi Guna, cannabis active principles are highly lipophilic. That is, they're fond of lipids. They just get into the lipids easily. What happens is, when it's lipid soluble, something is lipid soluble, it has better solubility and absorption because of that. And hence, it will have an improved bioavailability because body accepts lipids faster than the water bases. So it'll have increased bioavailability. That's where we'd want to explore further in the field of cannabis. So how do we move forward? I have spoken a lot about what Ayurveda says about cannabis, how we work around it, what all happens with it. So how do we move forward? We, as a company, are looking at these three main areas of research and bringing out products with that. First one, efficacious polyherbal formulations with cannabis as a primary agent. So as I was mentioning the IUCN list, eliminating the red-listed products, red-listed herbs, adding the cannabis over there, substituting it with cannabis, assessing its efficacy, and then seeing what can be done around that. And along with that, adding cannabis and other herbs to synergize the action of cannabis and then bring out formulations that are more potent can help heal a lot of chronic conditions, right from MS, multiple sclerosis, dementia, chronic pain, menstrual issues, whatnot. Infusion of cannabis into food products to deliver a desired care without compromising on the palatability. That's one area of research we would really, really like to explore, because whenever I suggest a CBD oil to a patient or a CBD extract to a patient, the primary concern of sublingual dosage is the taste. 2 drops and they say the taste lingers. There's a lot of negative effect of the taste. There's a lot of, smelly burps after that. It's very uncomfortable, especially the solvent-based extractions. So how do we counter that? What can we do there? How can we work around? By infusing those into food products to mask the taste. Masking taste in the form of food so that people can consume it safely and at the same time feel full also. So that's one more field we are into. And then introducing hemp seeds as a complete protein source. I come from a country where vegetarianism is the highest in the world. So we definitely lack protein supplementation to a great, great extent. How do we heal that? How do we, substitute that? Where do we find options? We can't go to people and say, eat meat. Many don't. They don't accept it. So what do we do? Where do we differ? Introduce hemp seeds. It's a complete form of protein, the best form of protein for the human body. So why not? Why not include hemp rather than, asking people to have meat? That will be a very, very safe substitution and considering the current global trend of veganism, where people are shedding, people are leaving meat, moving towards a more different kind of vegetarian options, vegan options, hemp has a very, very, very huge role to play. That's it.